This is your Houston chiropractor, Dr. Gregory Johnson, and we have Thomas here with us today from Bridge City, Texas, which is north of Beaumont. And he drove 2.5, 3 hours to be here with us this afternoon. And he's coming in here with severe herniated disc at L4 and L5, 8 millimeters at L4-5 and 7 millimeters at L5S1. And I know a lot of you out there can identify with that. But this is his very first visit here, and we're going to show you how much we can do for a severe herniated disc just in one visit. So let's take a look in the mirror first for us, Thomas. I'm going to have you relax your arms, and I'm going to have you close your eyes and flex your head forward and then backwards for me, please, sir. And then back to neutral with your eyes closed. Take a deep breath in, let all your air out. I love them when they're taller than me. That doesn't give me forward head posture. Do you sleep on your side mostly, Thomas?
Yes.
Yeah. I can usually tell a way a person sleeps just by looking at their posture, because he's rotated forward on the right side. Now his pelvis is translated to the left on the x-axis. You can't see that from where Renee's standing right now. But you can also see that his head is forward. His ear is dropping right here in front of his clavicle. It should be back here over his shoulder. So you can see that he's a good, probably 1.5 inches, almost 2 inches forward in his head posture. Now take a look in the mirror. See how your head's cocked off to the right there too, Thomas? Okay. And he's been getting some pretty severe right leg pain down here, plus some right sacroiliac joint pain here. So first thing I'm going to do, Thomas, is have you lay on your back on this table. And I'm going to do a few orthopedic neurological tests on you to evaluate your herniated disc. This is called a straight leg raise test, and this test will most often cause, now see, he's got pain already at 30 degrees in your lower back, right? Is it going in your leg yet?
No.
Okay. So I'm not going to go up any higher than that. He's got a positive straight leg raise. Does this hurt up there as well?
Mm-hmm.
Okay, so he has a negative Braggart's. That's a good thing. Okay, now, as I'm pushed down here, do you feel any pain in your hip or your back?
No.
Nope, good. Okay, so we're going to take it slow on this side because this is contralateral side. And tell me if and when you're there already. So see, he's got about 40 degrees on this left side. Now, I don't have an inclinometer here, so I'm eyeballing this, but I've been doing this 34 years, so I can eyeball them. Does it feel better down here?
Yeah.
Okay, does this hurt your back anywhere or your leg?
No.
Okay, let's cross this over here. I'm going to push down here. Tell me if this hurts in your hip or your back.
No.
Okay, good. Now, I'm going to have you push against my hand, pull up, turn in, turn out, pull up with your big toe, push down with your big toe. Okay, good. Pull up, turn in, turn out, push with your big toe, and pull up big toe. Good, okay. He's got good strength on both sides on the motor aspect. Let's lift your head up for him. Does this hurt anywhere along the course of your spine? No. No, good. Okay, let's sit you up and face this way towards your knee, sideways. Here we go. Okay, so I'm going to do a maximum foramina compression on him. Is there any pain anywhere when I do that?
No.
Okay, now I'm going to do a maximum foramina compression test right. How about that side?
So
Anything here? Yep.
So the
Tingle too?
Yeah.
Okay, that's pinching on the cervical brachial plexus. How about this left side? Anything over here?
Not
No?
much.
Do you feel anything down low?
No.
Okay, let's just tilt your head this way. Does that cause any pain or tightness anywhere?
No.
How about when I do this?
Yeah.
Okay, right through here? Okay, how about when you go this way? Tighter that way, isn't it? Does this cause tightness in that right one?
Yeah.
Okay, now just turn your head left. Okay, now turn your head right. Now see, he sleeps this way all the time, don't you? With your head turned that way?
Mm-hmm.
Yep. Look straight ahead towards your knee, and I'm going to push down, you resist. Good. Good deltoid strength on the right, and good deltoid strength on the left. You always check things symmetrically, bilaterally we call it. Just relax your arm right in my hand there. Just let it go. So I'm checking his biceps there, that's +2. Just let it relax in my hand. There you go. Brachioradialis is good, triceps is good, so he's +2. Reflexes on the right, just there you go. +2 on his biceps, +2 on his brachioradialis, and +2 on his triceps. Now scoot back that way just a little bit. So now I'm testing his patellar reflex on the left, which is fine. And so is his right one. Those +2 equal naturally. Relax your foot. Okay. And just relax your foot. Yeah. There you go. Good. Let me do this one more time. Relax it. Now see, this is diminished from the right side. Did you feel that? So that means he does have a diminished Achilles reflex. It only is +1 compared to +2 on the right. That tells me he does have some motor neurological deficit to his left calf. And you've been getting pain down into your left calf too, right? Okay. So let's have you stand and see if you can walk on your tiptoes only towards me for about 3 steps. Okay, good. That's a toe walk test. It's normal. Now, walk towards Renee on your heels only. Okay, that's a heel walk test. That's also normal. Good. Okay, now you can come back over here. I'm going to have you just face that way, with feet shoulder width apart. If you'll bend over like you're going to touch the floor and tell me if and when that starts hurting your back.
There.
Right there? Is it down here on the left side more? And in the middle?
In the middle.
Okay. Does it hurt coming back up?
No.
Okay, how about if you lock your knees straight and lean backwards? Does that hurt? Okay, and now if I twist you this way and push down, does that hurt more?
No.
Okay, how about when we go to the right and down? Does that hurt any more?
No.
Okay, good. Let's have you lay on your stomach for me next. I'm going to have you put your face right in here on this table. I'll get you on this one in a little bit. See, he's down here for that decompression because of his herniated disc. That's why we have people flying in here from all over the world to get that done. I'm one of only 3 chiropractors in the United States that does that. Now his left leg is short by 1/2 inch in this position. When I bring it up, it gets even longer. And yes, you can check people's leg length with their shoes on. Doctor. So, his left sacroiliac, that's tender right there, isn't it? Yeah, his left sacroiliac is out of place. That's why his left leg was shorter. It got even and even longer when I brought it up. So that's a positive Deerfield test. But he tightened up here and his pelvis raised up. So that's a positive Nautilus. Now see, he's got muscle spasm also down here in his pelvic muscles. That's a little tender all through here, huh? And right there's real tender as well. There's L5. That's the L5S1 disc. There's L4. That's probably tender as well. And he has paraspinal muscle spasm, so his entire lumbar spine has flattened out instead of having a nice smooth forward curve in it, which is called a lordosis. And when that happens, usually you'll get a lot of thoracolumbar pressure, paraspinal muscles, and I bet you those are a little sore as well, especially right there. Is that tender right there as well? Yep. Okay. Even though he's not having any neck pain or shoulder pain or upper back pain, I'm going to check his entire spine anyway. That's tender right there. And he's out right here on the right. Do you feel that one? And when you do get headaches, they start right here at the base of your skull, don't they? Yep. And he doesn't have any history of headache. Boy, that's really tender right there. And then right there. Okay, you ready to feel better?
Yeah.
Okay, all you gotta do is breathe. You get the easy job. So I'm adjusting his right sacroiliac joint first. And then I'm going to adjust his left SI joint first, which is internally rotated, and his hips out too. So I'm adjusting not only his SI joint, but his actual hip joint where it attaches into the acetabulum, or the rim of the ball and socket joint. And now I'm on his sacrum, which is the middle triangular shaped bone. His sacrum in the center, and sacrum on the right. And you notice I'm pushing the sacrum straight down away from the L5 vertebrae and disc, which will open up the space in here and give him some room. Now I'm going to drop L5 straight P to A. That was probably pretty sore. There's L4. That one was probably also sore. There's L3, and I'm sure that one was too. There's L2. Now, I'm going to put your head down just a little bit here, Thomas. There you go. Okay, now we're going to adjust his thoracolumbar. And you notice the angles that I'm taking on these lower thoracics. There we go. Exhale. That's it. Perfect. One more here. Okay, still got one. That's all of them. I think I still got one right here in your lower thoracic too. Yeah. Sometimes you got to come back to some of these ones that are hung up. So I'm going to put my elbow right down in the pocket, what I call it, right down here in the quadratus lumborum, multifidus, and erector spinae muscles. That's the ones that come all the way down the spine, especially are down here in the low back, and connect the lumbar spine vertebra to the big ilium bones on each side, which are plural is called ilii. He has a right ilium and a left ilium, a right sacroiliac and a left sacroiliac. Now I'm on this left pocket down here in the quadratus lumborum, multifidus, and erector spinae, and I'm putting some deep, steady pressure into those, which will help relax the muscles. It hurts a little bit while I'm doing it, but it feels a lot better when I'm done. And he'll feel a lot better when he quits hurting. There we go. So I'm going to put my elbow deep, deep down into his left paraspinal musculature in his pelvis. That one was tender, huh? And then down here in the piriformis, which goes from his sacrum to his actual hip joint. Now I'm going to move over to this right side. Now this is not near as bad over here. Is the left side much more tender?
Yeah.
Yep. That's tender right there, though. See, when you misalign the bones in the pelvis, you can't just pay attention to the one side that's hurting, because the pelvis all works together along with the rest of the spine. So that's why we adjust everything on every patient from head to toe. And now checking his leg length, and I check where the sole and the heel meet, not the bottom of the heel. His legs are exactly even, and I bet you this already is going to feel a little easier this time. That feel a little better that time, Anthony?
Yeah.
Good.
Thomas.
Okay. Excuse me. So I'm going to break out the heavy machinery on Thomas, and we are going to work deep in his tissue. So take some deep breaths for me, Thomas. I was doing that where his paraspinal muscles were pretty tender, and they do get tender because this is a really deep myofascial release instrument that I'm using. So now I'm going to be nice to him. I'm going to use the Genie Rub to increase the circulation into these tissues. I just want to take this opportunity to say that many people like Thomas come here even though they've been being seen by other chiropractors, and Thomas has even had spinal decompression treatments with the DR9000, right?
Yeah.
Which is a spinal decompression machine. They're really, I think, just glorified traction machines. I'm sure DRX9000 don't like to hear that, and those who use it, but it provides traction in the lumbar spine. And I'm going to let Thomas tell you, because this is his very first adjustment here at Advanced Chiropractic Relief, the difference between what I do, which is the manual spinal decompression for the herniated disc, and how he feels differently than what he does when he's on the DRX9000. I'm not saying the DRX9000 is a bad spinal decompression machine, but that's the machine. I'm a human, and I feel things with my hands, and God leads me into doing exactly what I'm supposed to be doing to get these people well, because he's the one doing the healing and just uses me as the tool and the instrument of his healing power. And whether you believe or not, Renee and I do, and we pray for each and every one of our patients healing every single day. On the way in here, before we get in heavy Houston traffic. It's a lot nicer than that deep turbonator, isn't it?
Yeah.
Everybody agrees on that point. Notice I did more kind of a transverse friction across his paraspinal muscles. Because the fibers run up and down like this. So when you get in deep and you go across the fibers, you actually help break up those myofascial adhesions that develop. And that's what creates the chronic long-term pain and spasm that people have associated with herniated disc or sacroiliitis. And that's what he has, is herniated disc and sacroiliitis, because his sacroiliac joint on the right side is subluxated, which means misaligned, pinching on the nerves. So he's exactly even still, and I bet you this feels even easier than the last one.
Yes.
Yep, good deal. Okay, so let's turn you on your back now. And again, even though he doesn't have cervical spine pain, I am going to adjust his neck because this is all part of the spine. Tilt right just a little. Perfect. There, good job. I bet you didn't realize you were that noisy in there. There we go. Okay. Now, when someone has a herniated disc and comes here, you will always see me evaluating the knees, which is a little bit loose on his medial and lateral collateral ligament there, and then decompressing him from the bottom too. Did you feel that in your knee and low back?
Yeah.
Okay, good. Just breathe and relax. There we go. Good. That one moved too. Good. Okay, let's sit you up sideways and face this way towards your neck. No, this way. Towards your neck. Yeah, this way. There we go. Sit sideways.
This way, Thomas.
There you go. Towards your knee. That's all right. All right. So I'm just going to check your shoulders for good measure. And you notice that every time I adjust a patient, I don't just adjust the area that they say they have pain in. I adjust the entire body because it all works together. Good. You feel your elbow move there? So I'm adjusting these digits now, the phalanges. Excellent. For all you crack addicts, I'm sure you heard all those. We have a lot of crack addicts that watch our videos. They're not on drugs. They just like hearing popping noises from the spine extremities. And they don't like me talking when I'm adjusting.
Just be quiet.
Okay, so let's come over here now. Okay, here comes the big kahuna. This is my ring dinger. I'm going to have you lay on your back with your pelvis right there. And that's a term that I coined, ring dinger, because it gets everything. Go ahead, slide up just a little bit to where your hips right, no, straight up that way. To where your hips right underneath that, good. And this is going to feel really tight, Thomas, but it's supposed to. Now I'm going to raise his legs up to where his lower legs are parallel with the floor. And by the way, if you go home and lay on the floor and put your feet up on the couch like this, this is the same position that I recommend people sleep in. Now he's a little taller, I know, WD-40. He's a little taller than most, so to get his legs elevated a little bit more, I'm going to have you lift your bottom legs up here for me. And I'm going to put this pillow under there. There we go. Does that feel a little more relaxed? Yes. Does that relax your lower back muscles? Good. Okay, so now we've got him parallel with the floor. I'm going to wrap this wet towel around his occiput and his mandible. And everybody's always asking me why I use a wet towel. Deep breath in through your nose. Keep your teeth together. Let it all the way out. Oh, yeah. Do you feel that all the way down, Thomas?
Yes.
Okay, good. And he's still kicking. Okay, I'll take this here. Just keep breathing deeply. Now, when you have herniated discs, you can't just lay on your back and sleep all night, can you? Because it hurts too much. So if you raise your legs and elevate them like this, it'll allow you to start doing so. But don't put a big pillow under your head because that creates forward head posture. Okay. And he's a big guy in the upper body here, so I'm just separating his sternoclavicular joints and AC joints here a little bit. There we go, good. Now, let's turn sideways and come this way. Okay, you can get up either way, it's fine. And come over here in front of the mirror for me now. Now, I might have you face the mirror like we were a minute ago. And make sure your feet are even for me, please. But not together. Shoulder width, there you go. Now, I'm going to have you close your eyes again and go forward and backwards and remember how it feels. Now, he's already got improved range back to neutral. Improved range of motion. Look how much his ear came back. It's about an inch back further than what it was. I can look in the mirror right now. See how your head's not tilted to the right as much? Mm-hmm. And look how much more even we are here. Yeah. And your hands are almost at your side. So your homework, like everyone else, is lift up with your traps, pull back with your rhomboids, flare these hands, palms forward. You see how that tightens up your entire trapezius muscle? Yes. You might want to spread your feet a little bit further apart on this one. Then I'm going to bring your head, let your neck relax. There you go, way back in the Z-axis. Because you're right, see, we're going to do exactly the mirror image of that to the left. Then I'm going to tap your atlas right there. Right there. His pelvis is already in the center, so I'm not having him move down here. Okay, relax that for a second. Now I'm going to stretch you. And I'm going to bounce the muscle spindles in your traps here to reset the Golgi tendon apparatus, which is what controls the muscle tension. Now, when I get done with this, when you go forward and backwards again, this should feel smoother, Thomas. Tell me if it does or not.
Yes.
Okay, back to neutral. Now look at his posture now. His ear is dropping right here now, which is about an inch back further from what it was. But if he keeps doing this exercise where he pulls his shoulders up and back and then brings your head straight back, bring your head, no, tilt it back. There you go. Now see how his ears are over his shoulders? This is a corrective postural exercise called mirror image exercises. And relax. Take a look now. See how you're even more centered?
Yes.
That's good. Okay. Thomas, would you mind sharing with our YouTube subscribers and viewers, how did this feel compared to the DRX 9000 to you?
Oh, it's something else.
Was it different?
Way different.
In what way? How would you explain it?
The technique that you have to work people here, they get on a machine just to pull.
But that's just kind of a slow traction,
yes.
Right? You felt every one of your vertebrae move all the way down, right?
Every one and every muscle, everything.
And it usually knocks the pain pretty quick. How's your pain level right now?
It's like probably 1, 2.
Compared to 8, 9 when you came in. Yep. Very good. So this is your Houston chiropractor, Dr. Gregory Johnson and Thomas here, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.